Thank you so much for joining this latest episode of Politics for Parents. It is Women's History Month, so I'm kicking off the month of women forward content I'm going to have here to start off with a discussion of reproductive rights and reproductive health care. With the constant barrage of insane headlines out of the White House, I know I've personally felt a little bit distracted from the national headlines and the gutting of the government. Um, and thinking about, this continued attack on women's health care and abortion rights, which is absolutely going to continue and probably intensify in the years to come. And over the past few weeks, I've been talking to women around the country, especially moms, and it is clear now more than ever that moms in America are suffering. We are suffering on so many levels because it seems like, you know, when you talk about the village that it takes to raise a child and all the supports needed to raise healthy and happy children, every lever of support that we've thought we had has been taken away. Um, and let's just be clear, women have always had to do more, work harder, meet higher expectations, and we have not been given the investment and the value in our society that is necessary for us to be the best we can be, both for ourselves and by extension for our families. So we came into this administration with we saw the she session during COVID and how so many women left the workforce simply because, we all have seen the statistics around the amount of work women do around in the home as well as for their families, not to mention their full-time jobs. So, we already came into the Trump administration seeing women in America suffering on the backs of insane workloads and demands from society, on the backs of the Dobbs decision. And here we are now. I've heard so much suffering and concern for lack of access to health care, not only post Dobbs, right, and the reduction in care we've seen women receive around the country, but also with, the looming cuts to Medicaid and what that would mean, especially for women in rural areas that are already underserved when it comes to health care and reproductive care. We've seen a reduction in the social safety net, um, especially with SNAP benefits, school lunch programs, education funding, funding for special needs children. Um, we saw New York Times headlines recently talking about the backslide in attitudes towards women among the Republican Party and people who identify as Republicans, and men and women who think women should go back to quote unquote more traditional roles, perhaps not work and be, independent and self-sufficient when it comes to earning income, um, and should instead just be, I guess, staying at home. So, the discrimination, the misogyny, I think that have been emboldened now under this administration. The Trump administration has emboldened radical right views on women. Um, and really regret I mean, regressive is I guess a nice way to put it on the backslide we've seen in women's rights now. um, so I wanted to bring that all together with this episode and talking to Kaitlyn Wojtowicz. She is the vice president of Public Affairs for Planned Parenthood Action Fund in New Jersey. New Jersey is obviously a blue state, where we don't have the draconian abortion measures others states have. And for that reason, we are also seeing an increased need for care at our clinics in our state. So I talked to Caitlin about what Planned Parenthood here in New Jersey is seeing in terms of trends and the needs for services. Um, Caitlin is a specialist in legislative, policies around these issues. So we'll talk about a package of bills that are here in New Jersey in front of our legislature to strengthen access to care and shore up our citizens' rights in the face of increasing federal tax. We also talked about the federal landscape as well. There's already one bill in the House has been introduced to restrict care. There will be more. We are seeing the potential misapplication of the Comstock Act to greatly reduce access to care. So those are some things we talked about, but also bringing it back to the goal of always giving you all quick action items. There's some great information and also ways to think about this in a constructive framework as you think about your own advocacy and what you can meaningfully do to advocate with your federal representatives and your state representatives to make sure that you can hopefully increase access to care where you are and push back at every single turn on every threat to any further impingement on our rights. So thank you for joining. I hope you enjoy this discussion. Take a look at the show notes with the podcast to make sure that you are fully informed and ready to advocate.
I'm Dr. Stephanie Wilson. I'm a historian, an activist, and the host of the Freedom Over Fascism podcast, where we talk to people who give us insight into the current political moment, inspiration for state and local organizing, and connections with our co-conspirators all across the country. You'll meet rural organizers who focus on electing young and diverse candidates, independent journalists who prioritize democracy over disinformation, and candidates building change at the state and local level. I invite you to join the Freedom Over Fascism community and listen to Freedom Over Fascism wherever you get your podcasts.
Thank you so much for joining us this morning. I really appreciate your time. I know you're really busy right now, given a lot of action around women's health care and abortion and reproductive rights. So thank you so much for joining us. I'd love for you to talk a little bit about your work with Planned Parenthood and your role there with Planned Parenthood, as well as I think one thing people don't realize about Planned Parenthood is the separate arms of it, the C3 versus C4. So touch on that as well, and just tell us about your work.
Yeah, absolutely. Thank you so much for having me today, Nicole. So I serve as the executive director for Planned Parenthood Action Fund of New Jersey, and we advocate on behalf of the two Planned Parenthood affiliates in New Jersey that deliver the healthcare and operate the health centers. So we have Planned Parenthood of Metropolitan New Jersey that covers 3 counties in the northeast part of the state, so Essex, Passaic, and Hudson counties. And then Planned Parenthood of Northern, Central, and Southern New Jersey operates health centers in the other 18 counties.
Okay. We've talked a little bit about the landscape post Dobbs decision. So obviously, I think most people know it's been bad nationally, but here locally, I know we've seen kind of an increased need for services. So I'd love to talk to you about what you've been seeing here in New Jersey after the Dobbs decision.
Yeah, absolutely. So since the Dobbs decision in June of 2022, we have seen 19 states and counting completely ban or heavily restrict access to abortion care. What that has meant in New Jersey, obviously, is that we are seeing patients from out of state. So we're very fortunate that back in January of 2022, before the Dobbs decision, the legislature passed and Governor Murphy signed the Freedom of Reproductive Choice Act, which guarantees in state law your right to reproductive health care and abortion, or including abortion, but as well as access to birth control to continue a pregnancy. And so we're very fortunate to have that right in state law. And I also like to say when talking about patients coming to New Jersey, because we do see ourselves as a safe haven for folks to come and get the reproductive health care that they need and the abortion care that they need. It's pretty common in this area. I think as someone who lives in New Jersey, Nicole, it's not uncommon to go to Philadelphia or go to New York City if you need to go to a doctor's appointment or a specialist. So it's very common that we would have seen before Dobbs, folks from Pennsylvania. I like to give the example of Morrisville, Pennsylvania is right over the bridge from Trenton, New Jersey. That might be your closest Planned Parenthood health center. So that was pretty common. But after Dobbs in 2022, it started pretty slowly. But now, on average, and I can only speak for Planned Parenthood health centers, so the number is likely higher. If you were to include other independent clinics or other hospital-based providers, about 100 patients a month from out of state. That number is also likely higher because patients are scared to disclose if they're coming from a state like Texas. So we're finding out anecdotally, or maybe after a patient has left and they say, "Thank you so much. Actually, I I came out of state and I was nervous. So we see, like I said, on average about 100 patients a month, but those are the patients that feel comfortable disclosing to us and that are coming to Planned Parenthood health centers.
For anyone who's not like threading the needle on this, why would someone be afraid to tell you where they're coming from? Like just
Absolutely.
quickly, because
Yeah.
that's insane.
Yeah, I know. It's hard to imagine as a person sitting here in the state of New Jersey what it must be like to be terrified to travel for healthcare because that's what this is, right? It's healthcare.
Hmm.
And if you have someone coming from a state like Texas, which has laws that aim to restrict someone's access to abortion care, there's also laws that are going after the patient or people who help the patient to access care to make it a criminal act, to make it a they call them almost like bounty laws that they're trying to go after the patient but also go after the support folks. So people come to New Jersey and feel like they may be doing something illegal, and I should be very, very clear. Abortion is legal in New Jersey. It is accessible. If you are coming from another state, you have every right to receive abortion care here in New Jersey, and that holds true for other states where it is still legal to have an abortion.
You can see in New York, uh, you know,
Yeah,
I'm sorry, can you hear me
a little,
now?
it's like a little in and out. Yeah,
Hmm. Okay, how's this? Is
that's
this
yeah.
okay? So having said that, there was just the case in New York where I think it was Louisiana, was it trying to extradite a doctor in New York? So they were, from what I gather, they were following the laws in New York, but Louisiana is now trying, I guess, to exert jurisdiction in New York. So is that something that you guys are watching or thinking about here in New Jersey?
Absolutely. So I can say very quickly after the Dobbs decision, as well in 2022, New Jersey's state legislature passed several pieces of legislation that were aimed at protecting providers and patients here in New Jersey, or patients coming to New Jersey for care. One of those is an anti extradition law, basically saying the state of New Jersey will not comply with someone saying, we're charging a doctor or a patient in your state and we want you to extradite them. And the state of New Jersey said, we're not going to do that. They also won't share health records, um, that have to do with trying to track if someone had an abortion and be used in a criminal proceeding against someone. So we're very fortunate that the legislature thought ahead and very quickly acted. We're also working on some further protections that we see as necessary, but um, what we saw in the New York case in particular is that a doctor in New York prescribed via telehealth medication abortion to a patient in Louisiana. And now Louisiana is saying that you violated our state law and is going after the doctor. I know New York acted pretty quickly to try and protect doctors further. Um, but I will have to say, unfortunately, these attacks are going to keep coming and they're going to take new form. And I even like to say we don't quite know where all the attacks could come from because they are so draconian and uh, just cruel and just aimed at making people suffer. And I think that folks who work in this arena, who work in advancing reproductive health care and rights, that's just not how our brain operates. We're trying to make sure people have access to the care that they need and deserve. So we're constantly looking out for what potential threats could be out there. And unfortunately, I think we're going to see some, I'll say, creative ways of trying to continue to attack doctors, patients, providers in the years to come.
Okay, so you mentioned Texas, and I want to come back to that because one of the things that I think about, this is politics for parents, so this is about policies that impact families. Um, but abortion and reproductive care is very much relevant to that because we see all the time women who already have children that are already moms that need access to abortion care because abortions don't always go as planned. And in Texas, ProPublica, I've been following some of their reporting and some of the studies they've been doing on maternal mortality in the wake of the Dobbs decision and their draconian laws. So that's one thing I always like to remind people of is like, why are you talking about abortion on a podcast about, policies that impact families? Because this is an issue that does very much impact families and mothers and children.
Oh,
So,
I couldn't agree more. Um, Abortion care is part of the full spectrum of reproductive health care, whether we're talking about birth control and preventing pregnancy, all the way to having a healthy pregnancy and continuing or starting your family. Abortion care fits in that spectrum. We, as advocates of reproductive health care and rights at Planned Parenthood and other groups that have been working on this, reproductive justice organizations like Sister Song and other groups that have been long working on reproductive justice, but also Black maternal health and maternal mortality. Because I'd be remiss if I didn't mention that, Black women, especially in the state of New Jersey, have
absolutely.
higher maternal mortality rates and infant mortality rates than white folks. And there's been work to try and combat that, and there's still work to do. And that's true for across the country as well. But when you restrict abortion access, you're not just stopping an abortion from taking place in that state, you're making it riskier for someone to continue a wanted pregnancy. Um,
Mm-hmm.
an abortion or the abortion procedure is the same procedure that is used to in miscarriage management. So if someone's miscarrying and it's not completing naturally, they may need a procedure to help, complete the miscarriage. That is the same exact procedure, whether someone's having an abortion because it's not the right time to have a pregnancy or they have enough children and they're happy with their family size the way it is. It's the exact same procedure. So when you're restricting access to a procedure, it's not just affecting those folks that you're thinking about. It's affecting, pregnant folks who want to be pregnant but are unfortunately having a miscarriage and now can't access the care that they need.
I mean, that's exactly how I look at it and I frame it to people within this context. And also, while we're talking about access to care, another lovely ingredient in this stew of just absolute insane laws that are attacking women, we have the recent GOP budget resolution, which is likely going to gut Medicaid, which then is going to have ripple effects, all right? When you have tons of people that are now not participating in the healthcare system the same way, especially in underserved communities where we typically happen to have higher instances of maternal mortality, especially among Black women, um, that's going to have another layered effect, probably, what a lot of folks are saying, where you already have places that are underserved where Black women have a dearth of access to reproductive care. And now we're going to see more health centers shutting and more providers leaving areas where they can't really do their practice. So, this is just yet another piece of this puzzle where, we're really putting women at risk in this country. So,
Yeah, I mean, Medicaid is it's not hyperbolic to say it's a life-saving program. It provides folks with low incomes access to medical care.
yeah,
It's an insurance program for folks with low incomes. And Planned Parenthood is a proud uh, provider that takes Medicaid. There's lots of different people who use Medicaid for lots of different reasons, and so I just want to underscore that this attack on Medicaid, while it will impact, Planned Parenthood and patients, really, right? Like you're taking away a patient's health care, so the impact on the providers will be felt. But this is about the people who are just trying to get their birth control or just trying to go to the eye doctor or like who just need their diabetes medication. Like it's so many different folks, and I I just can't say enough about how it is really about taking away healthcare from millions of people. And so we can talk about it from the reproductive health perspective, but it's so much more than that. And it would be devastating to patients and people across this country.
absolutely, absolutely. Um, And that's within that. So how does Planned Parenthood handle it? Because you speak it all to, let's say, Medicaid tomorrow is gone, and you see a patient come in who now does not have healthcare insurance, but she needs care. How does Planned Parenthood handle that?
Yeah. Well, what I would say is Planned Parenthood, just as it operates, especially here in New Jersey, I can talk for New Jersey health centers. No one's ever turned away because they can't afford to pay, and that's just true now. And that's our value and our mission as a healthcare provider. And my job is to advocate on behalf of the healthcare providers. So if someone comes into a health center and they don't have health insurance, they maybe have Medicaid, or maybe they do have health insurance and they don't want to use it because uh, they just don't want it on their like insurance record that they were there for a certain type of care. Um, Planned Parenthood is a nonprofit healthcare provider, and they just make sure that everyone can get the care that they need. Whether it's pay what you can, or we have one of the I believe both of the Planned Parenthood affiliates have patients assistance funds that try and help patients to make up the difference in the care. So no one's ever turned away because they can't pay. Obviously, losing Medicaid would be, like I said, devastating for the patient. It would impact Planned Parenthood health centers, um, but we would continue with our mission that we want to make sure everyone has access to the care that they need and deserve. And so my job is going along with my colleagues across the country and nationally, that our job is to make sure that folks understand how devastating these cuts to Medicaid could be and why we need to push back against this and make sure that it doesn't happen.
Right. So that was just a great little opportunity to let folks know that if they're listening and they have the means, they should absolutely consider supporting their local Planned Parenthood. I know here in New Jersey, I'm involved with the Access Fund, which I'll link to in my Substack. And yeah, you guys are just doing amazing work. And I think in the face of a lot of the turmoil that's to come, you're going to fill an important gap. And I want folks to constantly be remembering the importance of giving now more than ever. Um, so we talked about the attacks to come, and you did touch upon the fact that Planned Parenthood provides um, birth control as well as abortion services. And I came across a great little gem the other day that it's in Congress now, HR 685. It's really got a cute name called the Save Moms and Babies Act of 2025. But from what I can tell, it's not actually designed to do that at all. So I'd love to talk a little bit about this bill, what you're watching with it. Does it have any, potential of passing, or, what's going on here? This.
Yeah. So what I actually want to touch upon is some of the federal threats as we have seen are planning for them at Planned Parenthood. And I like to joke that we know how to plan at Planned Parenthood. So unfortunately, we're used to having to keep an eye out for threats. We're definitely watching this piece of legislation. The sponsor, Chris Smith, is a congressman from New Jersey, and he is very known to be anti-reproductive rights and anti-reproductive health care. Some of the big things that we're watching obviously are the Medicaid, which we've already talked about, and possibly losing Medicaid. The other one is the misapplication of Comstock. And so that the Comstock Act, which is, a zombie piece of legislation that's potentially going to be brought back to life, would restrict the mailing of quote unquote obscene material through the mail or common carrier, so FedEx, UPS, things like that. And that is one way that could be used to restrict abortion access, even in states like New Jersey. So that would mean that providers couldn't get supplies because they couldn't order them. They couldn't get medications. They wouldn't be able to potentially mail birth control pills to folks in New Jersey because that could be considered obscene material, but you can't get them through the mail. So that's one thing that we're actually really watching at the federal level. We know that Congressman Smith likes to perennially introduce legislation attacking reproductive health care. But that's one of the big ones that we're watching alongside the Medicaid that we're really concerned about. And of course, there is the potential for a federal abortion ban piece of legislation that would outright, say abortion's illegal, that's probably less likely. What we think is the way that folks who are anti-choice or anti-reproductive health care will go after access in states like New Jersey will be the misapplication of the Comstock Act.
Where is the Comstock Act? That one, I feel like that is quite technical. So it's a little more tough to follow even for me. So kind of like where is that and what can we do if we're concerned about it? Would we call our reps or?
So the Comstock Act is from over 100 years ago. Like it was meant
Yep.
to stop information on birth control being sent through the mail to teach people how to control the size of their families if they wanted to. It was also used to prevent, pornography from being mailed. It's a law that has not been enforced or used for, I want to say decades, but that feels like too little of a term to use. Like it's just not used. It's on the books still, unfortunately. So that's why we're saying this is a misapplication. This was never meant to be used to restrict the mailing of medical supplies, which is how it could be used, right? So that's the Comstock Act. What folks can do is, and it could be about the Comstock Act, it could be about Medicaid coverage and ensuring Medicaid as a program remains intact. It could be about the fact that you just support reproductive rights and abortion access. Yes, call your representatives, call your congressional representatives, even if you agree with them or you disagree with them. Call them, let them know where you stand and where you want them to stand for you, because they're supposed to be representing us in Congress, and they should hear from their constituents about the issues that they care about.
There are over a dozen co-sponsors of this bill for the 685 bill. And it's ironic that often the folks who sponsor these anti-abortion, anti-reproductive care bills, anti-women's health care bills, are also the same folks voting to cut Medicaid. So, if Chris Smith is your rep, I would simply call him and say, what is your problem with women? Why don't you think we should just have adequate care that we need and control over our bodies? Anyway, let's get back to the states then, because now there's stuff happening on the federal level. There is a myriad. I mean, I feel like almost every day I see something else happening in another state that's bananas. But here in New Jersey, it seems like we're pretty good on women's health care and reproductive care. So, what's the state here in New Jersey? And are there things that we still need to push for and things we could do better?
Yeah, absolutely. Right now, I think more than ever, states have such a crucial role to play, state legislatures and governors, when we are facing these attacks federally. So here in New Jersey, yes, we have some really great case law that was decided at the state Supreme Court level, as well as I mentioned earlier, the Freedom of Reproductive Choice Act, which guarantees your right to reproductive health care in New Jersey. So we are great when it comes to guaranteeing the right. There is more that we can be doing to protect and expand access to healthcare. So we at Planned Parenthood Action Fund of New Jersey, alongside of our coalition partners in the Thrive New Jersey coalition, are working on passing a bill package. It's 9 bills, and it's called the Reproductive Freedom and Health Equity Bill Package. And it's comprised of bills that do everything from guaranteeing insurance coverage without cost sharing for folks seeking abortion care, malpractice insurance protections for providers, saying that your insurance provider for your malpractice insurance can't just raise your rates unnecessarily or drop you because you're riskier to cover now because you're providing legally protected health care in New Jersey that might be illegal in another state. Making sure that folks can access the entrances to health centers, because unfortunately we do have protest activity at not just Planned Parenthood health centers, but other abortion providers across the state. And we are seeing attacks on the Freedom of Access to Clinic Entrances Act federally. There's been a bill introduced to repeal it. President Trump pardoned many FACE Act violators and released them from jail recently. So we're trying to put those protections into state law to make sure that people have access to their health centers, and you can't be blocked from accessing that. There's also loan redemption for reproductive health care providers to try to make it easier for them to continue to provide this life-saving essential care. Um, there's 9 bills. Like I said, I could go on and on and on. But if folks are listening and interested in learning more, they can go to our website, ppactionnj.org. And there's a whole landing page with resources and fact sheets, and you can see all the bills that we're working on.
Awesome. And roughly kind of where are they in the process, just if folks kind of want to follow along and figure that out.
Absolutely. So we have this great graphic actually on our website that shows you where each bill is in the process. So,
Awesome. Love
yeah.
it.
But one of them has passed in the Senate. Three others have had hearings in the Senate. Right now, it's budget season in New Jersey, so the legislature kind of takes a break to focus on that. So we expect that we'll be working on these, this spring, over the summer, when it's going to be a little bit of a lull, and obviously into the fall. So we're going to just keep working and moving ahead and trying to get these passed in the Assembly and get the rest of them through the Senate.
And speaking of the spring, summer, and the fall, I just want to remind everyone that if you're in New Jersey, we are going to have elections this fall in our state legislature. So if this is an issue that matters to you, it is really, really important to know who's running in your district for assembly, for Senate. We have a governor's race, if you haven't heard, and make sure that their views align with yours when it comes to this issue. As a voter, just make sure where everyone stands and you're mindful of the elections coming up this fall, because as we said, the state's legislatures are going to become more and more important in these years ahead. So I guess, I always like to leave folks here with a call to action. I think we've already gone through a few here. I love that your website has a graphic about where the bills are in the legislature, because I think we suffer a lack of transparency here in Trenton, and even me, I struggle to follow things as they move through the legislature and then into committee and back out, and amendments and so forth. So that's great. But what are some other things you think folks should be doing right now if they're listening to this and they have a few minutes to get involved?
Yeah, absolutely. So the first thing I would say, if you're here in New Jersey, go to our website, ppactionnj.org. On our landing page for the bill package, you can also send an email, several emails actually. You can personalize them, but we've pre-populated it for you to legislative leadership and to your 3 members, your 2 assembly members and senator, letting them know that you support this bill package. So it's very easy. It takes, I think, 3 clicks maybe, if that. It's very simple. So you can go and fill out our action alert. If you're not in New Jersey, or even if you're in New Jersey, call your congressional representatives, call your senators at the federal level and your members of Congress, and let them know what you care about when it comes to reproductive health care, and urge them to represent your views in Congress. And the last one I would leave folks with is make sure you're registered to vote. Make sure your voter registration is updated, especially that's true for across the country, but especially in New Jersey, we do have a governor's race and all 80 members of the assembly are up. So help someone register to vote. Make sure your voter registration is updated, and make sure you exercise your civic duty.
Also, if you can, go to your local Planned Parenthood or wherever you can and donate. Donate to your clinic, or if they have an access fund like ours, make sure you support them financially if you have the means. I can't, underscore that enough. And just to go back to your state representatives, I've heard from so many folks this week who are calling their state reps for the first time. Someone in another state that I was talking to, their rep answered the phone and they were just shocked. They're like, I've been calling my congressman, I've been calling the Senate. All I can do is leave a voicemail or talk to an intern. But like, I called my rep and he just answered, and I was so flabbergasted. Or folks have been getting calls back from their reps if they leave a message with a staffer. I know, some of our reps here in New Jersey, I know mine, Vin Gopal, is so responsive, and Margie Donlin and Lynn Peterpaul. I almost always hear back from them directly on an issue. So I really want to encourage folks, if you haven't yet, contacted your reps, make sure you know who they are. Save their numbers in your phone because you're probably going to need them, and give them a call, because you'd be surprised at how much engagement you really get with them. And you really can make a difference at the state level through that, and even if you get a few friends, you all call, on the same day or something, it does, they notice, they hear you. So, thank you so much, Kaitlyn. Really, really appreciate your time. Um, and thank you for all the work you do. And we will be sure to kind of stay in touch and see how things unfold in, the months and years to come on this front.
Yeah, thanks, Nicole.
Okay.